Hi, I'm talking today to UK optometrist Simon Rose. Hi Simon, thank you so much for letting me interview you for Askimo TV's International Library of Interviews with Experts.
Thank you. Good morning from London.
Simon, today we're going to have a discussion about myopia, also known as nearsightedness. So what is myopia?
Myopia is mankind age-long condition where the eyeball is slightly too big, or the lens inside the eye and the cornea of the wrong power, that causes the image that you're looking at far off to be cast in front of the retina, and it needs a correction in front of the eyes with a contact lens or with refractive surgery or with glasses or with wait and see orthokeratology to push the image onto the retina, onto the film in the back of the camera to give clear image. And the reason it's called short-sightedness is people that are myopic or short-sighted can't see far, but they can see short, they can see close. So they can hold things very close and see clearly, but anything beyond arm's reach, they cannot see clearly. And that is short-sightedness or myopia.
Who suffers from myopia? Is it adults, children, both?
It is a global phenomenon and is on the increase. There's an epidemic of myopia. We now are seeing in some areas in the Far East, 80+% of people under 14 are short-sighted. But it's for everyone.
How is myopia diagnosed?
Sorry, is your question how is myopia diagnosed?
Yes.
Good. The diagnosis of myopia is very simple. A routine eye test from the optometrist is one of the easiest ways of doing this. There are automated devices called autorefractors, which use infrared to focus on the length of the eyeball, and they can give a fairly accurate prescription, very accurate number. There are things called photo autorefractors for very young children, on babies, where you can get quite an accurate test. All of these things are useful tools when examining patients.
And once you've diagnosed the myopia or nearsightedness, what are the various options people have? Like, how do you know if a person's a better candidate for laser eye surgery or for the wait and see orthokeratology option?
The level of myopia dictates the type of correction, but the options must be given to the person who is short-sightedness. There is no age barrier to any of these systems except refractive surgery, where they would be very mindful not to have any type of refractive surgery before 23 or 24 because of the changes in the eye when one is younger. But contact lenses and glasses and wait and see orthokeratology can be used on any age group, really, even youngsters, real youngsters.
How can myopia affect your lifestyle if it goes untreated?
Myopia is the biggest, myopia and lifestyle, myopia is the biggest cause of blindness in the world. There's more blindness due to the need for glasses than there is for cataracts and anything else put together. It's a very simple thing to treat with glasses or contact lenses, and sadly it's not being treated globally as well as it perhaps could, but it can be easily dealt with.
Is treating for myopia part of a standard examination that the optometrist would do, or should I specifically ask that my child or myself be tested for myopia?
No, myopia is one of the main things that an optometrist would look for in any age group. What unfortunately may not happen is that all the options may not be presented to the patient. Very often in the very retail-driven large conglomerates, they will wish to sell glasses rather than offer other options like wait-and-see orthokeratology, like contact lenses to the parent or to the child, because it's not as a profitable exercise. But one must really rely on the professional to offer to the parent and the child all the options that are truly available and let them make their own choice.
Thank you, Simon. Thank you so much for talking to me today.
My pleasure.